Choosing a Medicare plan is one of the most important decisions a person can make, not only for their health and well-being, but also for their wallet. Joining us now to discuss this and share tips on how to make the best choices when it comes to your Medicare coverage is Chief Medical Officer at United Healthcare Medicare and Retirement. That is Dr. Philip Painter. Good morning to you, Doctor.
Morning.
We appreciate your time this morning, so let's break it down. What can you tell us about this current Medicare annual enrollment season and why it's so important? Because time is of the essence, really.
That's right. You're right. We're coming down the home stretch of the annual enrollment period for Medicare. So it started October 15th, ends December 7th. And why it's so important is it's a chance for people to assess and change their Medicare coverage. And as you said, that's really important for their health and well-being and also for their finances, because the decision they make is likely going to be with them for the next year until the annual enrollment period starts again. So they should be thoughtful about that decision, and it's an important one.
And when you're looking at the different plans out there, do you have any tips or advice to help make that process a little easier?
I would say first, look at the current coverage you have. If that coverage still works for you and it hasn't had a significant change, fits with your health and your lifestyle and your finances and needs, then you can keep that coverage. But if something has changed, this is the time to look and potentially look at different plans or different options for you. But do that initial assessment first. That's easy. Look at your current coverage and then make some changes if you need to.
And then the most important question, because the word important's in it, what are the most important things to consider then when enrolling in a Medicare plan?
Yeah, I would say, three main things, and that would be coverage, cost, and access. So what does the plan cover? Does it cover the basic things you need? Does it cover extra things like vision, dental, hearing, or even over-the-counter benefits? And then what's the cost of that plan? So what are the monthly premiums and what are any co-pays or cost share you might have? So for example, United Healthcare, we've got many plans that have $0 premiums and no copay for things like primary care visits, telehealth visits, lab, or even screenings. And then is there a maximum out of pocket that you have to pay? Original Medicare doesn't have a maximum. Medicare Advantage plans do, and that gives you some extra security and protection around your cost exposure. And then lastly, look and see, is your doctor and your preferred hospital or health system in the network? That's very important. And do you have access to healthcare in other ways? So for example, United Healthcare does house calls for our Medicare members, which is a licensed clinician who can come into your home and actually give a comprehensive visit. And that's great to get that kind of care or evaluation in the comfort of your home. So those are the areas I think people really need to look at when they're evaluating a plan.
And we have just about a minute left, but I want to touch base about prescription drug coverage. What advice can you share when you're looking at plans for that?
Sure, just real quick, important that your medicines are covered and that they're part of the pharmacy plan. Don't want to have to change your medicines, especially if they're working very well for you. That's important. And then, is your pharmacy and pharmacist in the network that's there? You don't want to disrupt that relationship. And lastly, what's the copay for those medicines? We've moved many medicines to $0 copay, tier 1 at retail it's called. So lots of options for people around drug and prescription coverage.
And December 7th is coming up, so where do we go for more information to get this started?
Sure, great place to go, uhcmedicarehealthplans.com. Gives you a chance, just great general information of Medicare and a chance to compare plans and find the plan that's right for you so you've got the best coverage for next year.
Well, Dr. Painter, we appreciate your time this morning and giving us this advice for viewers who perhaps are entering into this for the first time or looking to change up their plans. Appreciate your time.
Great, thank you.
Get the most out of your plan. You want to because it's your health. Learn more at the website on your screen, like you mentioned, uhcmedicarehealthplans.com. You have until December 7th.